My name is Dr. Sharde Harvey. I'm a general cosmetic and implant dentist. I practice at 121 East 60th Street in Manhattan. And I love being a dentist because I love science. I always love science and art, and it's a perfect combination of science and art. I love being a dentist because I meet lots of interesting people and I help them to create their smiles, and when they walk out happy with their smiles, it makes me happy. I feel great about what I'm doing for work. I also get to form a lot of great relationships with my patients, and I enjoy seeing them. They're kind of like an extended part of my family. I think a smile is really important because it's kind of like in the middle of your face and it's what people see all the time. It helps you to express yourself. It's part of the aura of a person. You can get instant rapport with someone with their smile. You know, when you meet someone for the first time and they smile at you, you establish an instant level of comfort. I think I'm actually a perfectionist because my mom is a perfectionist. When I was a little girl, she would give me chores to do. She would teach me how to clean a room, let's say, and it would start by all these small little details of like filling up the bucket with water, cleaning agents into them, and having like a towel. She would make me get down on my knees and clean like corner to corner. That was her thing. And everything that she did, she showed me that she would do it perfectly. And so I think that I actually got that from her. After I did the work, she would check everything to make sure that it was like to her liking. So I think I actually got that from her. I have a lot of hobbies. I do yoga, I paint in oils, and I read quite a bit. When I was a kid, I used to read a book a day. And now I read a lot of articles about new dental technologies. I'm also a consultant for Dental Product Magazine. One thing that makes me unique as a dentist is that I have a trademark called the lunchtime crown. I have a CEREC machine in my office, all German technology. It helps me to scan a patient's tooth. Like, let's say a patient comes in with a broken tooth. Instead of them waiting for 2 weeks before, their tooth or a crown comes in, I can actually scan a patient's tooth and make it in an hour. And they can just come in their lunchtime, sit in a chair. I can work on them for about an hour and fix their tooth all within an hour. And that's why we call it the lunchtime crown. A case of someone that I know that I've changed their lives is a young man who came in with his jaw off to the side. I examined him. I inquired about whether he had a car accident at any point in time. It came to light that he's never had a car accident. His jaw was just always like that. When he was a young boy, his jaw has always been off to the side. I looked at him, we took a CT scan for him. I didn't see any reason for why his jaw would be off to the side, except for the fact that the way that his teeth lined up. After I examined him, I said, I think that we can fix your smile and your jaw by realigning your teeth, because he had a crossbite on one side, which meant that his teeth were kind of like this, off to the side. After looking at the way his teeth came together, I realized that if I did Invisalign for him and realigned his teeth, then everything would line up, and that actually shift his jaw back over. And I will tell you that I'm so happy that that patient placed his trust in me, because even after 6 weeks of him wearing Invisalign aligners, you could see his jaw starting to shift back over. Midway in his Invisalign treatment, his jaw almost completely back in alignment. So that's a case that I remember. It was a case that I wasn't sure we're going to be able to do, but after examining him, I was quite confident that we would be able to realign his jaw back into position. So that's a case that I feel really proud about.